Gonorrhea is one of the most common sexually transmitted infections, and it has been getting harder to treat because the bacteria keeps learning how to resist older antibiotics. For years, the main recommended treatment relied on an injection, which can be a barrier for some people, especially when quick access to a clinic is not easy. Now, the FDA has approved a new single-dose oral antibiotic called Nuzolvence, also known as Zoliflodacin, in granules that dissolve in water. In this video, I will explain what gonorrhea is, how it spreads, why treatment matters, what makes this approval important, how Nuzolvence works, who it is for, how it is taken, and the side effects and key safety warnings you must know. Gonorrhea is a sexually transmitted infection caused by a bacterium called Neisseria gonorrhoeae. This bacterium can infect the urogenital tract, meaning the urethra and cervix, and it can also infect the rectum and throat. When the FDA talks about uncomplicated urogenital gonorrhea, they mean a localized infection of the urethra or cervix that has not spread to other parts of the body. The infection may cause symptoms, or it may cause none at all. And that is part of the danger because people can carry and spread gonorrhea without realizing it, which allows it to silently move through communities. Gonorrhea spreads through sexual contact, including vaginal sex, oral sex, and anal sex. The bacteria can infect different sites depending on the type of contact. It can pass from one person to another even when symptoms are mild or absent. That is why prevention, routine testing for people at risk, and fast treatment are so important. Another key point is reinfection. If one partner gets treated, but their partner does not, the infection can bounce right back. That is why partner treatment and follow-up testing matter just as much as the first dose of medicine. Symptoms depend on the site of infection and the person. Urogenital gonorrhea can cause painful urination, genital discharge, and swelling. Some people notice burning, irritation, or increased discharge. Rectal infection can cause pain, discharge, bleeding, or itching, but it can also be silent. Throat infection may feel like a sore throat, or may cause no symptoms at all. The problem is, untreated gonorrhea can still cause harm even when you feel fine, and it can still be transmitted to partners, so symptoms alone are not a reliable way to rule it out. If gonorrhea is left untreated or not treated properly, it can lead to serious complications. In women, it can spread to the reproductive organs and contribute to pelvic inflammatory disease, which can increase the risk of infertility and other long-term problems. In men, it can lead to painful inflammation and complications as well. The FDA notes that untreated infection can result in more widespread infection of the reproductive organs and infertility. Beyond personal health, untreated gonorrhea increases community spread. And the more the bacteria spreads, the more chances it has to develop and spread antibiotic resistance. For a long time, doctors treated gonorrhea with a combination of an injection and an oral antibiotic. More recently, treatment guidelines have recommended a single injection of ceftriaxone for uncomplicated urogenital gonorrhea. That treatment works, but relying heavily on one main option is risky when resistance is rising globally. Gonorrhea has a history of outsmarting antibiotics over time, so the medical community has been waiting for truly new options, especially options that are easier to deliver and can help protect public health. That brings us to Nuzolvence. Nuzolvence is the brand name for Zoliflodacin. It is an antibacterial drug in a class described as a Spiropyrimidinetrione, and it works as a bacterial type 2 topoisomerase inhibitor. In plain language, it targets enzymes bacteria need to manage their DNA as they grow and reproduce. Without that function, the bacteria cannot successfully multiply and survive. The FDA approved Nuzolvence as granules for oral suspension, meaning it comes as granules that must be mixed with water before you take it. It is designed as a single-dose oral treatment, taken once, not a multi-day pill schedule. Nuzolvence is approved to treat uncomplicated urogenital gonorrhea due to Neisseria gonorrhoeae. It is approved for adults and for pediatric patients, 12 years of age, and older who weigh at least 35 kilograms, which is about 77 pounds. This specific approval matters because uncomplicated urogenital describes a localized infection of the urethra or cervix that has not spread. It does not automatically mean it covers every possible site of infection in every person. That is why diagnosis and medical guidance are important. Your clinician chooses the right treatment for your situation. The FDA called these new oral approvals a significant milestone for uncomplicated urogenital gonorrhea, and the reason is clear: more effective options help patients and help public health. The FDA also emphasized that additional treatment options are particularly important because gonococcal drug resistance is rising globally. When a disease is common and the bacteria is getting tougher, new treatments reduce the pressure on any single drug. That can help slow resistance over time, especially when antibiotics are used appropriately. And from a patient perspective, an oral single-dose option may remove barriers for people who struggle with injections or access to certain clinical settings. In the FDA-reviewed pivotal study, researchers tested Nuzolvence in 930 patients with uncomplicated urogenital gonorrhea. 2/3 received a single 3-gram dose of Nuzolvence dissolved in water. The other group received a standard regimen that included a ceftriaxone shot plus an azithromycin pill. The study measured whether the bacteria was cleared 4 to 8 days after treatment. The results showed that 91% of patients who took Nuzolvence were cured, compared with 96% in the standard treatment group. These results supported FDA approval, and they show Nuzolvence can be an effective option when used appropriately. Nuzolvence has specific instructions about food, and they depend on body weight. For patients who weigh 35 kilograms to less than 50 kilograms, the label instructs taking it on an empty stomach, 1 hour before food or 2 hours after food. For patients who weigh 50 kilograms or more, the label instructs taking it with food. This is tied to how the body absorbs the medicine. These details matter because proper administration helps ensure the drug exposure is in the range expected to clear the infection. There are important situations where Nuzolvence should not be used. It is contraindicated in patients with a known history of hypersensitivity to Nuzolvence. It is also contraindicated with concomitant use of moderate or strong CYP3A4 inducers, because these drugs can lower zoliflodacin levels and may reduce effectiveness. This is why your clinician or pharmacist must review your medication list, including prescription meds, over-the-counter products, and supplements. This step is not optional, it is part of safe antibiotic care. Nuzolvence comes with strong reproductive safety warnings based on animal studies. The label warns about embryo-fetal toxicity, meaning it may cause fetal harm when administered during pregnancy based on animal data. Because of this potential risk, the label advises avoiding use during pregnancy and obtaining a pregnancy test prior to initiating treatment in females of reproductive potential. There is also a specific warning related to males with female partners of reproductive potential. Based on an animal toxicity study, the risk of early pregnancy loss may be increased in female partners of males treated with Nuzolvence. The label advises males with female partners of reproductive potential to use effective contraception for at least 3 months after the single-dose treatment. When people ask, what is the best treatment for gonorrhea, the true answer is a full plan, not just a drug name. The best plan includes accurate testing, the right antibiotic selected by a clinician based on the infection site and patient factors, and prevention steps to stop reinfection. Public health guidance commonly advises waiting before resuming sex after treatment. For example, CDC patient information advises waiting 7 days after finishing all medicine before having sex, and partners should avoid sex until both have completed treatment and symptoms are gone. Retesting is also important. CDC patient information advises retesting about 3 months after treatment of an initial infection, even if partners were treated, because reinfection is common. These steps protect you, protect your partner, and reduce community spread. So what makes Nuzolvence stand out? First, it is a single-dose oral antibiotic, which can be simpler than multi-day regimens and may improve completion because there is no day 2 or day 5 to forget. Second, it represents a new class and a novel approach for gonorrhea treatment in an era where resistance is a serious threat. Third, the formulation is designed for mixing with water, which can help some patients who struggle with swallowing pills. That said, best always depends on the individual. Contraindications, pregnancy considerations, potential drug interactions, infection site, and local resistance patterns all matter. The right move is always clinician-guided care. Let's recap. Gonorrhea is a common bacterial STI that can be silent but still harmful, and rising antibiotic resistance makes new options extremely important. Nuzolvence Zoliflodacin granules for oral suspension is an FDA-approved single-dose oral antibiotic for uncomplicated urogenital gonorrhea in adults and in pediatric patients 12 and older who weigh at least 35 kilograms. It must be mixed with water, taken within 15 minutes of mixing, and food timing depends on body weight. Common side effects include headache, dizziness, nausea, diarrhea, and lab changes like low white blood cell counts. Major warnings include embryo-fetal toxicity risk, contraception guidance for males with female partners of reproductive potential, potential risks to male fertility based on animal studies, hypersensitivity reactions, and C. difficile-associated diarrhea. If you want more clear, patient-friendly breakdowns of new drug approvals and the science behind them, subscribe to Drug Insight Hub. Share this video with someone who values accurate health information, and leave a comment with the next drug you want me to explain.